Welcome to The Smart Life. I'm Olga Villaverde. The coronavirus crisis has changed life dramatically for people around the country and has left us with so many questions. Joining us today to help us answer some of these very important insurance questions is Pat Garrity. He is the CEO of Florida Blue. Welcome to The Smart Life, Pat.
Thank you, Olga. I'm happy to be with you.
Oh, I thank you so much for your time. I can only imagine how busy you are. I want to start with you and Florida Blue for that matter. You know, Pat, we hear every day the news is just different about this virus. We don't know when it's going to slow down. We don't know when it's going to end. So for employees, members of the community, what have you done? What has Florida Blue done? And why have all of these early actions really been so imperative for our community?
So right away, we were focused on how do we help our members? And the first thing was, how do we help people get tested for COVID-19? And so we helped bring some of those testing supplies to locations around the state. And we waived all of the expenses. So nobody was going to pay to have a COVID-19 test if they were covered by Florida Blue. The next thing was, how do you take care of the expenses of treating for COVID-19? And so we've waived all the expenses for our membership. So there's no deductible, no co-insurance. If you're treated for COVID-19, we're paying all of those expenses for the next 2 months. So we really wanted to get out in front of that and make sure that our members understood that we were on their side and looking out for them. The next thing was also embracing telehealth. We had 2 million members who already had telehealth, but we extended that to all of our membership. We want to make sure that people can be triaged appropriately by contacting a clinician and doing it from the safety of their home and not exposing themselves to others in a doctor's office or in an emergency room unless that was the appropriate place for them to go. Taking care of our seniors, they're the most vulnerable during this period of time. And so let me just tell you a quick story about something we've done for seniors. Our main campus, we had to close out our kitchens, given that everyone's now working from home. But we kept our kitchen staff employed by creating a deal with them because the Feeding Northeast Florida didn't have the contributions that normally flow in there. Farmers in the area weren't producing the same amount of goods for restaurants because restaurants were closing down. We connected the farmers to the food bank to our kitchens, and we're producing 1,500 meals a day for seniors where everybody would have been dislocated. Instead, a creative idea kept everybody employed and focused on how can we all work together to help people during this difficult time.
Oh, that's fantastic to hear, Pat. And we hear so many stories like this of people truly working together, and that's how we're going to get through this. Now, obviously, this is not a typical interview. Let's be honest. Normally, I would be in the studio, and you would probably be a guest at the All Health Channel studio as well. You're at home. I'm at home. How is the remote working going with the employees and just with the communication with your members as well?
Well, one of the most important things during a period like this is communication. And how can you do that most effectively? We literally have 12,500 people working from home. Our IT job organization did a fabulous job. We literally did not miss a beat. We took this very seriously from day one. I'm literally now in my third week of working from home. So we took as job one the health and safety of the people that work for our organization, knowing that people who are comfortable, they feel safe, they're in an environment where they've got the right equipment, they're being communicated to, could do the best job for the people that we serve. So we saw that as our responsibility to the people that are employed by us.
I have so many other questions I want to get to, Pat, especially the economic and health impact of this crisis. It's going to be huge. So many people are out of work. Some people could be furloughed. There's so many examples. Tell us what options our viewers have for insurance, because this is certainly not the time for someone to go without.
You know, there's a lot that is in flux right now, for sure. You know, making sure that we waived the co-insurance and deductibles was an important part. of saying to our membership that we were going to take care of them. It really depends on how long people are in this unemployed mode, and we don't know the answer to that question right now. One of the things that we've been sort of making our case known in Washington is that we think there ought to be a special enrollment period for the Affordable Care Act. We're the largest carrier of Affordable Care Act membership in any one state in the nation, with 1.1 million people covered. We think that open enrollment could be opened up and we could bring more people in, providing more coverage across the state. So that's something we've actually been asking Congress to move on. And we think that that would be a very important step towards giving people the security that they have coverage during this period of time.
What are some of the other changes to Medicare because of the coronavirus, sir? Do you expect these changes to stay in place even after this crisis is over? Is it too soon to tell?
It's probably too soon to tell, but I think we're all learning things about what can be done in this new environment. I'll give you a great example. In your marketplace, we have the Sanitas medical clinics, and they have done an unbelievably good job. They've learned lessons. They are operating in the United States, but they also operate in Spain and in South America, and they've learned from other places in the world. So with the Sanitas medical clinics, very effectively, they have a screening tool up front that tells them what risk the patient is at. They've also been able to take their COVID patients and use one particular clinic to meet their COVID patients while they can see other patients in other facilities. One of the real dangers in the healthcare sector is if you intermingle your regular patients and your COVID patients, it becomes an environment that is actually dangerous to somebody. So Sanitas was very thoughtful about how to bring people to the right locations, keep them separate from others, get them the care levels that they needed, and keep many people at home until they either needed to be treated differently or could be taken care of. Many people have recovered from this virus in a home setting, and the key is isolation. And so the important part of that process is knowing how to triage the patient from the start. And Sanitas has done just a wonderful job in that area. And so it's been very, very important, our partnership with them, because we've learned from them and they've done just a great job for South Florida.
And I was reading about that on the website before we started the interview. And I actually wanted to touch upon that website because I was really pleased to see, number one, how easy it is to get to floridablue.com. And the first thing I noticed, and I took some notes here, it was a large yellow bar, and it says obviously coronavirus. And I loved how it had tips, like here's what you need to know. And I'd like you to explain that to our viewers because sometimes they just feel things are too difficult.
Really just going on the webpage, floridablue.com, and clicking on the COVID-19 bar, you then are brought into a page that's completely dedicated to COVID-19. It gives you information. It give you information about where you can be tested in your area. It gives you information about how to navigate through understanding what your symptoms are and what are the best steps for you to take. It gives you informational videos. So we had some folks in our team that are in our digital team who worked rapidly to make sure they could bring this web page alive. And we also had the infinite wisdom of last year. We hired Dr. Kelly Wells, who was a public health doctor, and she came on our staff. Well, very well positioned now because she understands all of the public health implications here. And so we're bringing that knowledge to our membership and to the community. Regular sessions where she educates both our employees and we open that up to the community so that people can see those educational seminars. And some of that content is on that webpage as well. So we really encourage people to go to floridablue.com and look at the COVID-19 webpage. It's simple to navigate and there's lots of great information there.
And Pat, I don't want to forget about those that have been let go from a job, those that have been furloughed. Just what happens to their insurance?
So it depends on their given circumstances. But if you've been let go from a job and you're typically that is a qualifying event, and you are then eligible to enroll in the Affordable Care Act. And so our lines are open. You can call Florida Blue. You can enroll in the ACA. Depending upon your income, you would be eligible for a subsidy, which may pay some or all of your insurance coverage. So my first recommendation to anyone in that circumstance is that being let go of your job is a qualifying event. And so you ought to look at enrollment in the ACA, and we're here and happy to serve you.
I want to thank you so much for your time. Truly appreciate it. And any new news that you hear regarding new developments, please come back on The Smart Life and educate our viewers. We'd love to have you back.
My pleasure. Nice talking with you today. Thank you.
Be safe.
Be safe as well.